call the meeting to order. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good afternoon, everyone. Is there any comment from the public?
The vast sea of people. I'm surprised we can keep them all under control. Shocked.
I know. Well, they're a well-behaved group.
Behind the barricades.
Yes. So let us hear from Mr. Meade. You have to identify yourself.
Certainly. Good afternoon.
Good afternoon.
Commissioners, nice to be here. Jack Meade, Register of Deeds, Barnstable County.
Great.
Here too, I take it,
We just
inform you
wondering
how things are going.
How are things?
Things could be better, but
Yes.
they're not terrible. To sum it up briefly, so far we've only had 2 months of figures for 2010, and from a money perspective, we're actually actual revenue to the county, we're ahead of where we were last year. That's because of 2 factors. One, we increased our excise tax.
Right.
And 2, we have been busier. So our revenue for our county income on the business side, what people pay for recordings, is up because we're recording more things.
Right.
Mostly as a consequence of refinancing of mortgages. We're up about 25% from a year ago in terms of the number of mortgages that are being refinanced, which in my mind is a positive sign in that it would seem to indicate that banks are willing to lend. People, they're getting a sense of the valuations so that they can make loan assessments based on.
Right.
I think maybe we've hit a bottom, or they can put an effective valuation on a piece of property. One of the troubles that I think the industry's been having in the last year or so is there's the huge reaction to probably the lack of good assessments or oversight on the assessments and appraisals of the properties leading up to the debacle in the market. And so now all the underwriters, everybody in the process is very conscious of valuation and loan to value and the true valuation or appraisal of property. At the same time, it's very difficult from an appraising end of things to come up with an accurate appraisal because of the market's very volatile.
There hasn't been a whole lot of activity.
So if you go to buy a home, for instance, there aren't a lot of comps around, maybe for that particular home you're looking at, especially if you're in the mid-market range. And at the lower end, it's hard to, that's been an active but volatile market. It's also been the one that's more subject to the foreclosure market, which inhibits pricing, effective price evaluation. So anyway, all that stuff has been going on the last year or so. So I think that's made it somewhat difficult for the market to operate effectively. But as we're starting to see mortgages pick up, again, this is me looking for green shoots here, but I think as we see mortgages picking up, that to me gives me a sense that there is some comfort in the market, and they're able to make these things happen. These refinance deals happen. So
That's a positive sign.
The refinancing, is the refinancing affected by the raise that we had in our fee schedule?
Well, we haven't raised fees, and the county doesn't raise the fee. The fee schedule is different from the excise tax.
That's what I'm getting.
We have nothing, the refinance has nothing to do with excise. So one refinances their house, they're not paying an excise tax in any way. They're paying a recording fee. Those fees went up in 2003, and that was done through the legislature. The county did not raise the fees.
Right.
The legislature did.
And that leads to the question as to whether or not the activity that we've been seeing, has that been affected by the increase that we made in that?
I doubt it. I mean, I'll be honest with you. I mean, but I can't attribute it one way or the other. And we haven't been seeing activity for a while. We've been seeing a decline in activity and sales activity for, the last
Right.
couple of years. There was no excise tax raised in the last couple of years. So, I
Right.
mean, there was no, that was not,
It didn't have the impact.
didn't have, that clearly state for the last, more recent history has not been affected by the excise tax. To try to then calculate whether the last 2 months has been affected by the excise tax, I would be loath to
Right,
make
because
that.
the activity has increased.
No, the activity hasn't increased for sales. That's
Okay.
what-
Oh, I see what you're
that's
saying,
what
right.
Bill's pointing out,
Okay,
yeah.
right.
Our sales activities, we've got more money
Right,
because we have a higher tax, but we've actually had fewer transactions
right.
compared to a year ago.
Mhm.
Then again, we've had fewer transactions compared to the previous years for, it's been a cycle that we've gone through for the last, 3 or 4 years now. Slowly, every month's been less in terms of the volume of activity that we've had from our peaks.
Okay, well, that tends to support the raising of the tax in order to improve the revenue that we'd retrieve from the
Exactly.
activity that, that was going on.
Well, yes, I mean, if the point of raising the tax was to cover the operational costs of Barnstable County, which I believe that was the point,
Right.
then
It's
so far, 2 months into this year, it's succeeding in effectively meeting the numbers that we had a year ago, the revenue we had for a year ago, in the face of a declining real estate market. My hope is that, I think everyone's hope is that the market will pick up. And the problem is, no one's got a crystal ball, so it's very hard to tell what's going to happen. I'm just sort of going by my old, been there, done that kind of thing, in the sense that back in the late 80s, early 90s, the first thing we saw when the beginning of the turnaround was measured by mortgage refinance activity. Somewhat different set of market circumstances. We were coming from double-digit interest rates and moving our way down, say, but we had just the whole been preceded by a significant decline in valuation from a high in May of '87 to a low in 1991, and that decline also in value also there was a decline in activity level as well, volume. As interest rates started to drop in the early 90s, say in 93, we saw a flood of refinance activity, and we weren't selling any houses. Now, nothing was coming across the counter for sales, but tons of mortgages were coming through. And then, over the course of the next few years, you started to really see sales activity pick up. In fact, our busiest year in terms of sales was 1999, not in the 2000s. So we steadily saw a pickup of real estate activity, but it was foreshadowed by the increase in mortgage activity. But again, it was a little bit different because we had a decline in rates that triggered that mortgage activity.
Right.
This time through, we really had the rates. There's been some decline, but it's relatively modest compared to the huge declines we saw in the 90s when we went from probably mid-double digit interest rates to all the way down to 8% in '93.
Right.
And so over the course of that time, once rates broke through the 10 barrier, they went down to 8, a couple points. People who could refi did.
Mm-hmm.
A lot of people were still upside down
Mhm.
from their mortgages. They bought houses in the mid 80s, and the valuations hadn't come back, but a lot of folks were able to take advantage of it. And as that happened, then values started to pick up slowly, albeit, but 5, 6, 8, 10% a year, and that's what it was doing all the way through the 90s, and then we hit 2000, and they started going crazy and doubling,
Right.
and doing those numbers.
Well, it was in the 2000s that really, in some ways, some people would say, inflated housing prices started to occur,
Mhm.
and then there was this frenzy of buying and.
Right.
Doing that as an investment for some people, or buying these homes, and quite frankly, nothing stopped people from buying houses at a higher rate.
No.
And now that we've had this economic setback, for lack of a better word, so what you're saying is it's sort of like still stabilizing right now. So the market doesn't really know where it's at. And the housing assessments haven't really gotten to a baseline of where they're actual. So the banks are maybe feeling a little bit more comfortable with how it's shaking out, although it's still, we're still having Trevor's.
And then that's just my assessment.
Yeah,
from looking at the
yeah, for the
numbers. I mean, I
anecdotal,
haven't
yeah, from
talked to the,
anecdotal experience, right?
talked to the
And I
bankers,
think,
but,
I think you're probably right. I'm
Yeah.
sure that there's more scientific information to back that,
Right.
one way or another, or dispute it. But I think you're probably right on that. So.
How are we with foreclosures?
Yeah.
What's the rate of foreclosures?
We're down from a year ago, but they picked up a little bit last 2 months. We had the spring a year ago. Spring was very high level of activity for foreclosures, and we this past March, April, May, things slowed down a bit, a decent percentage. Although this August, I think we had 4 fewer foreclosures than we had a year ago August. So that's still too many, frankly. But and I'll be interested to see. That's a number I'm curious about because going forward, because I think a lot of the folks who are just, we moved through a lot of foreclosures in about a year and a half period, and those are the folks that had nothing going in, and they borrowed 100%,
Right.
et cetera. The next wave of foreclosures, if it happens, it's more than likely going to be folks who had weathered that storm, but now may be facing a job loss or something like that.
Mm-hmm.
That may cause that to happen. But now I'm hopeful that number's going to continue to decline.
Where does one go to see where those foreclosures are? I mean, if there was.
Where they've happened?
Yeah, I mean, or is there like is that like a separate listing? Is that registered somewhere where house is in foreclosure and now it's for sale?
Well, generally what happens is the foreclosing party will, do the foreclosure and then immediately they'll buy it back at the sale. It's rare that a foreclosed home is bought by an outsider. It's generally
Okay.
purchased
That's
back
interesting to know. I
by
did not realize that.
the lender. And then they put it then they list it with a
So it's
brokerage firm.
the bank will list
Yeah,
it.
I mean, for a while it wasn't banks. Now there's been more. Cape Cod Five's been doing some foreclosures. It's been affecting some of some bank holdings. Up to this, but mostly mortgage-backed security lenders, or the holders that have been going. The secondary folks the loans that went directly to the secondary market. So what they would do is they would foreclose. They're usually bidding at they put a bid price that was higher, what the mortgage amount was, which nobody was willing to pick up because it's in 99 cases out of 100, it was more than the value of the property at present, and they wouldn't be able to generally get in to see what condition the property was in. I mean, it's one of the things I always, people say, I don't want to buy foreclosed properties. And you don't know what you're doing. You don't want to do that. You want to wait till they get foreclosed upon and then cleaned up, or at least you can go in and see what the status of the property is. That's.
You still have the FHA?
Do they still have it?
Yeah.
Yeah.
Because the first house I bought was an FHA foreclosure,
Yeah.
and they paid the closing costs, and they actually guaranteed that the house would be in reasonable shape because they had to pump the cesspool within about a week of us moving in.
Yeah.
But that was quite a good deal.
Well, I don't think they have as many regulations, but not to put a date on it. But I mean, there's more things that you have to check off the box before you can get a loan, from the next bank to buy a piece of property. But in any event, no one knows. The tenants the people who own it or are living in it may still be in the house at the time of the foreclosure too. So there are all sorts of, this isn't a primer on how to go to mortgage foreclosure, but the bottom line is the vast majority of the properties are taken back by the lender and then put out for to a mortgage broker, to
real estate
agent, real estate broker market.
Mhm.
And that's when those houses come out and people are able to pick them up and buy them. But at least you get to, you know, you
Where is
get
the
some-
statistical information kept that gives you the key on this?
Well, I mean, there are companies that make their living sort of putting all this data together.
Like Warren?
The Warren Group,
Yeah.
Banker and Tradesman magazine, they cross-reference assessors' data with our data. They buy our data, they buy the assessors' data. They merge it all together, and they'll be able to tell you, and they probably have GIS stuff that they put
Right.
together where they could put them in where are the foreclosures happening.
Mhm.
I mean, theoretically, you and I could do it, from our home computer.
Right.
But it would be a hell of a lot of work.
Right.
I
Right.
mean, to sit there and try to dot it out and get a map and mark the addresses and figure out where
Like Google the property.
right,
Yeah.
figure out where the great concentration of foreclosures
Right.
are happening. I mean, you could tell just by looking at street addresses on most of these things where, for predominantly, most of the foreclosures were happening, for a while. I mean,
Mhm.
we were seeing it, in Hyannis, you could throw a blanket over the areas that were getting foreclosed on
Mhm.
in a big way. Certain towns, where we could find that. It's now a little bit more spread out. They're not as concentrated. It's not as concentrated as it had been. It had been concentrated in Hyannis, a lot of it. Had been concentrated in some parts of Yarmouth, etc. But now it's a little more spread out. And you're seeing different valuations of properties that are being foreclosed on. I mean, you've got $1 million plus places going, and then you have got $500,000 stuff, and as well as what were being sold as $300,000
Right.
properties that are now going for $100.
Right.
So
Right.
that's,
Yes.
Getting back to the sales, the sort of
Right.
sales issues, I see some of those reports that the local papers sometimes print of the various towns. The volume is up, that the sales are down, or the cost is down, or the value of the homes, and this is up, and this is the same. And by the time you read 3 towns, you get totally confused
Right,
as to what's
right.
really happening.
Yeah.
More volume than last year, or less volume than last year. But do you see any pattern across the Cape at all in terms of the sales? Are they pretty much the same without the actual value of the homes, but just sales across the board?
it's
Hard to say,
it's
yeah.
hard to say. I haven't really looked at that. We do some stats for like Falmouth and Bourne and Sandwich. That's because we were directly asked to do those.
Oh.
But we haven't really in Barnstable. But we hadn't. I don't really have. I'm just trying to look back at my Banker and Tradesman. They do graphs on all this stuff, and they break it out. And I think that the sales activity has been pretty consistent, Cape-wide in terms of the volume of activity. Obviously, the pricing has changed.
Mm-hmm.
Certain towns are doing better than others. Chatham is always still, there's some high-end homes that are moving through there, and that seems to be, for the most part, all that's turning over in Chatham. But and the other end of it is the towns here are so diverse. You have, Falmouth, for instance, it's got so many different neighborhoods, and big, and we're so big. I mean, square mileage wise. I mean, it's what would be, a dozen towns outside of Boston can fit in, to Falmouth, and they would have different neighborhoods, et cetera. So
Right.
but we don't, and our sales aren't broken down sort of, Woods Hole, North Falmouth, East Falmouth, downtown, et cetera. So it's very hard to determine what part of town is
Right, right. Is
what
it
the sales are coming
higher
from,
end,
what's
middle
working.
class end,
Right, exactly.
or lower
And that,
class end?
that pretty much goes for the bigger towns. Barnstable's got the same deal.
So in terms of the revenue, say for the county, now we'll
Right.
switch to the county revenues. Say we're up for June only because of the tax increase.
Well, that in
Well,
business.
I mean July,
And,
not
July
in the
and
amount of
August,
business.
both, our numbers came in for August, our total amount of money we sent in the check over to the Treasury was higher.
Uh-huh.
Predominantly because we did more documents are coming across, we're doing more work. So we're getting our $10 per document, and that's
Right.
adding up. and we had a gross number was better on the excise only because of the excise.
So
tax
that really
increase.
did help us break even and keep us stable with last year.
If we
So-
hadn't raised it, we would have been
Been
below our
very
number.
different.
And it's really too soon to make any predictions in terms
I
of
think so. I mean,
trends.
I'd really like to see us, and again, I know because of how the way things fall, but our fall quarter, September, October, November, tends to be our busiest time. I hope that
So I
continues.
guess we'll see you at Christmas.
I hope that follows through. Yeah, I mean, we'll have a pretty
Yeah,
good
you come
idea
back, right.
by the end of November whether we're in big trouble or not.
Okay,
I mean,
yeah.
if things are proceeding apace, then we can say, well, we can sort of pretty much count on what we budgeted for. I think we're about even with last year.
Right, so we're breaking even.
Breaking even.
Right.
But if we don't see those sales, even an increase isn't gonna, and eventually we need to see that bump in sales. I'd like to see it. I mean, to me, volume is the precursor to everything. If there's more activity out there going on,
Exactly.
regardless of the value, then that gives you confidence that things are going to pick up,
Right.
and the prices will follow. It's when you just don't have a level of activity. You have to have a certain level of activity to have people feel confident in the market.
Right.
And until you get to that point, you're
Right.
you're in dangerous
No,
ground.
I agree, and I think that
And-
people are still kind of waiting to see, is this really the value of the house, or will it come a little bit lower?
Absolutely.
And what is going to be, because it was inflated, and
Right.
so this is the stabilizing effect of this.
No, and it may take a little while for our market because, I mean, the people tended to buy down here where, a good percentage of the purchasers were people who maybe sold up from uptown and moved down here, had money. It's not like they mortgaged 100% of their house or
Right.
they got anything going on and just thinking maybe they want to downsize a little bit or whatever.
Right.
But they're not in a hurry to take a bath on it,
Right.
relative to where they came in. They can hold on to it without any difficulty. It's
Exactly.
just, they would like to move, maybe 5 different houses. They always like that house and it's a chance to do it, but they have to sell theirs, but they're not gonna give it away in their mind.
Right.
So I mean, so there is that tendency there's
there's
a percentage of the market that has to sell,
Right,
and at
yeah.
a certain point they
They're
get out of there,
moving,
but
they're
that's
leaving,
not as big a percentage, I think, down here as it may be in other places.
Right.
So what we had agreed to before was that we would take a look at our revenues mid-year, end of
Mhm.
December, thereabouts, and if we
Yeah.
have mid-year corrections
Yeah.
that had to be made.
Well, I could, the minute, if I see something that's, concerning to me, or
Right.
I will definitely, be over here in a heartbeat
Right.
to let you know. But in the meantime,
Otherwise, no news
otherwise you
is
don't
good
hear
news.
from me or
Yeah.
things are going
Yeah.
well. But
Okay.
no, I mean, I'll make a point to come by and see you and try to keep you, and keep you abreast of things as they go forward. So, but, I mean, all things considered, I think we're in, pretty good shape.
Okay. Well, it was just an excuse to say hello.
No, I always enjoy coming.
Have you
by.
over, Jack?
Yeah, thank you. Thank you very
So
much.
I appreciate it. Are there any other questions or
Well,
comments?
what would be a target date for you to come back as far as the mid?
I could shoot for, first week in December or whatever, and that would
Yeah,
give
I
us,
think that would be good. Just
that'd be
put
3
that on
months
the
from now,
calendar.
and
If
that
we have
would
the
give me a
November
good,
numbers in, I think it would be important.
that would give us mostly,
Yeah, it's just
almost a
second
half year's worth of stuff, and I mean, and if we have to make some drafts, that you need to do an ASAP from that point of view,
Right.
but I mean, I think
Right.
we'll have a pretty decent idea, even after, the next 2 months, just where, how it's going.
I think that sounds good. That's the
All
plan.
right.
Okay.
Great.
Very good.
Well, then enjoy the rest of your afternoon.
Thank
Thank
you.
you. Good to
Yeah.
see you.
You too.
All right. Take care.
Bye-bye.
Bye, Jack.
Now we are scheduled to hear from, I believe, Beth, are you coming forward to talk about
Yeah.
Suicide Prevention Week?
Yep.
All right.
Tim.
Okay, Tim, and who else will, anyone else want to?
We're missing a few people. I guess we got messages. They're coming or they're going to be late, so
Okay.
we'll just go.
We're starting a little.
Yeah, we are.
5
We have to be over to,
Yeah, the 3 o'clock.
oh, this is our,
Yeah,
yeah, we have a
we
3
have a
o'clock
3
hearing, so we have to.
Well, I was here, what is it? Here, I'll give you those.
This is next Thursday, right?
Oh, this is also good.
You saw that?
Yeah, this is, yeah, we did. Yeah, I have it. Yeah, thank you.
I have a little anecdotal story. The first time I was exposed to somebody who was going through suicide ideation, I was a company commander, and one of my lieutenants came in, and he said to me, I still got the gun from being a duty officer last night. He said, I've been loading it and unloading it over and over again. And I said to him, I said, you're an important part of the unit. You're also important, you make a significant contribution to that, and you're important to me. And I said, I want you to go see the psychiatrist immediately. Now, it turned out that when I went to follow the psychiatrist, he said the most important thing that lieutenant needed to hear was that he had value, and that he also needed to see somebody who was a professional. So I wanted to say that. The other piece was that I was told that if you do hear suicide ideation, you should tell people about it, because you shouldn't hold it in for yourself, and because that's quite a burden to hold by yourself. So anyway, I thought I'd just share that story. I was 25 years old, a long time ago, but I hadn't forgotten that.
Well, I was here a few months ago. I think it was in February, and I gave
I'm sorry, before you get started, could you identify yourself and your organization?
Sure. I'm Beth Albert, the Director of the Department of Human Services for the county.
And I'm Tim Landwehr, the Director of Behavioral Health at the Community Health Center of Cape Cod. I'm also representing the newly formed Cape and Islands Suicide Prevention Coalition.
Thank you very much.
Thank you.
So, I was here in February, and I gave you an update about and asked for your support for a suicide prevention coalition that was forming in the youth grant that we had applied for. And so we're here today to give you an update on what's happened since then, and also to get from you something that you have prepared for us in regards to International Suicide Prevention Week, which is next week, the week of September 6th and through the 12th. So I wanted to give you the opportunity to provide you the update on the coalition. Tim's going to talk a little bit about the state of this issue in the region. And also we have some events planned for Suicide Prevention Week. You just received an invitation and a flyer about an event that's happening on the 10th. So I'm not going to read through everything I wrote for you, but it really just provides you an update on what's happened with the Suicide Prevention Coalition. When I came in February, we were just getting underway. We've made a lot of progress. We've gotten a tremendous amount of support from the community. We have about 75 plus members as of today in the coalition. We have
worked on governance. We have subcommittees working
and are starting to roll out some initiatives and strategies focusing on prevention and educating and raising awareness in the community. So before Tim speaks, you have the proclamation.
Yes, I do have the proclamation, so let me, I'll read the proclamation. Proclamation Suicide Prevention Week. Whereas suicide is the fastest growing cause of death for youth aged 15 to 24 in the United States, and is the third leading cause of death for adolescents and young adults, with a national rate of 30,000 youth suicides annually. And whereas suicide is the most tragic and disruptive event for families and communities, 1 in every 65 Americans are affected by the suicide of someone they know. And whereas suicide is a public health issue and is a community problem, and through education and awareness of the issue, a great number of suicides can be prevented. And therefore, we do hereby officially designate the week of September 6th through the 12th, 2009 as Suicide Prevention Week in Barnstable County, and do hereby officially launch the newly formed Suicide Prevention Coalition and the Youth Suicide Prevention Project for the Cape and Islands, for Cape Cod and the Islands. So here is your proclamation. It is actually, it's a proclamation on a topic that can send literally chills down my spine.
Tim is representing the coalition, and I know Beverly
Beverly.
is the chair of the Chenal.
Yes.
And the funding for this came through the Chenal, so Beverly's been very involved, and the Chenal's been very involved in the growing the coalition, supporting the coalition. The funding is coming through, had originally come through the Chenal. So, Bev, I don't know if you want to come up and sit with us and add a few words, or
Sure.
if you want to, but Tim, I'm going to let you.
I don't need to add a few words though, Tim.
Okay.
Okay, excuse me for reading, but extemporaneously just doesn't work now. My advancing age doesn't work very well anyway. But I just want to thank the commissioners, all of you, for your leadership and your attention to this issue today. It's been really a tough couple of weeks, particularly for some teams and their families. I think to a lesser extent, but it's also been somewhat stressful for providers in Barnstable as well. And I just want to express my appreciation for all the people that have really kicked in and helped out on this issue. The MH, for example, who's just been really helpful to us. And also just condolences to the families that are dealing with this issue. The issue of suicide is really obviously difficult for everybody, and one attempt or completion can affect many people and result in really deep sadness, guilt, shame, and quite often, kind of a secondary trauma for families and other loved ones and friends. There are many variables that go into any completion, I think, that make the problem of suicide for youth or really across the lifespan very complex. Addictions, depression, grief, loss, lack of timely access to treatment being just a few. And I think each case, although there may be similarities, there's certainly each case may be different. And that's what makes it, I think, so complex. But I want to say, amidst the weight of the recent losses, there's some good news. And as we've talked about already, we're in the process of establishing the Cape and Islands Suicide Prevention Coalition, and there's a lot of momentum with that, and a lot of involvement, and I feel like the community is starting to galvanize now. I think that's really positive. I'm also really encouraged about the project that's coming through the Community Health Center of Cape Cod, the Cape and Islands Youth Suicide Prevention Project. Maura Weir has been hired. She's been with us for a couple of months. She's really dynamic. She's on the ground doing just a lot of work, really starting to drill down on the problem, and is really sort of formulate what will become in years 2 and 3, hopefully, ultimately a region-wide pre- and post-vention plan. Post-vention being how do you handle completion, prevention, that term being obvious to us all. So we're very excited about that. And she would be here today, except she's still figuring out Cape Cod and traffic patterns.
She called me a little while ago, and she said I put it in the GDF?
Yeah.
She said I put 6 eggs.
Oh, God, help her.
Yeah.
So she's now in Truro.
Yeah.
That's right. Yeah, well, it actually doesn't, probably right in the beginning. Yeah, right in
You
the
all will be meeting her, I'm sure,
Yeah.
particularly if you come to our prevention day.
Right.
And I just feel positive in the sense that we're beginning to shed light on this issue, and I think if we can work together as a community, that's really the key thing. I mean, we need all sectors. So any leadership that you guys can provide will be much, much appreciated, and thanks for today as well.
Beverly, did you have something?
No,
you'd
I
like
don't
to
have
add?
anything to add. They did a marvelous job.
This has been a bad couple of weeks, and it appears to be one of these situations where it's copycat frenzy, which is a phenomenon that I try to understand, but it's a hard concept. But I think youth, just doesn't see the whole enormity of what they're doing and the finality of what they're discussing when they discuss these things together as pacts and that sort of thing. Where does it sound as though maybe there's so much rallying around this issue at this point that maybe it's getting under control for this particular wave?
Well, I think just there was an event last night. I think there's a tremendous amount of resources. Tim, you mentioned the Department of Mental Health has stepped up to the plate. I mean, in the article that was in the Cape Cod Times this morning, there was a number to call. And so I really think raising public awareness and getting out the number where you can call if you need help is going to be critically important, so that people. And I don't think that number was widely known. So that's a big thing onto itself, just getting that number out there. So I think it is a community-wide effort. I think bringing resources in, raising awareness, providing training, all of these things are underway and are moving forward, and maybe now with a little bit more urgency than a few weeks ago. But
I think too, last night that was pointed out that that we may still have a suicide happen, but it could be that we could have had 2 or 3 if this initiative wasn't started. So sometimes it's hard to see progress, but that we need to trust each other that we're doing what we need to do to do the pre and postvention work, and that also while we have a real concern about youth, we also have other populations here on the Cape that have high numbers of suicides, such as white males and elders.
right,
So,
in the coalition, and we should point that out, is a lifespan coalition. So we're not just looking at youth. Tim's particular project coming out of the Community Health Center is focused on youth. It's particular, and it's a 3-year funded grant that we received through it's through the Mass Coalition for Suicide Prevention, but the money comes from the feds, from the Garrett Lee Smith,
Through the state.
through the state.
I thought the most important thing that Dr. Macy said last night was the importance of understanding that there is a time when we begin to hear these things.
it's more on the radar screen.
Yeah, and that you have to be sensitive. And one of the most telling things that I think he said was that you have to be able to ask the question of what is meaningful to a kid, what is meaningful to you right now, and be able to listen in what I would call not a passive way, but in a way that does not act in any judgmental, act at all. Because the first thing that would turn off a kid is if he's been able to express himself, then, or her, then the next thing is you really have to just listen to what's going on. And I'm sure that he was absolutely accurate with it. When you do that and you hear what kids tell you, it could really blow you away. So, but the point that he made was very important. The other point that he made that I think is very important is the issue of kids, and we all want to know where we belong, who we belong to, and the final thing, can we trust the people that we belong to stay, to continue to be connected to us. You haven't spoken about this, but he is offering training, I think, through that grant.
Well, there's a lot. Go ahead. I mean, there's a lot of stuff coming up. That's one resource with training coming to specific groups, and I don't even know the details about that. There's also there's other training curriculum that's been brought into schools. Mm-hmm. There's training that we've received, the QPR training. We're doing frameworks training, which is it's like a community model for this. So there's when I said there's a lot of initiatives and things kind of moving forward, and we can get that information to you when those trainings are going to happen.
I sent the flyer to Kathy yesterday.
It just went out. But I think the key piece is also, I mean, most providers are already trained. So what we really need to do is reach, beyond that circle out to people that intersect with youth. Right. And the other thing that we've talked about from I think from a practical perspective is the importance of kind of starting to lower the bar. When you're not vigilant, you're not maybe watching as closely as you might be. But we're really, the coalition is really trying to spread the word that it's very important to pay attention right now and kind of lower the bar in terms of scrutiny, and anybody that may be having any thoughts, we really need to get that person connected to care.
And that's a great segue into, because I want to say what the number is that was it was in the paper last night, but if there is somebody that needs in crisis or needs to speak to somebody, they can call. There's two numbers. One's an 800 number, so it's 800-322-1356. I'll say that again, 800-322-1356, and that's directly to the Department of Mental Health. And then there's also a psychiatric assessment team at Cape Cod Hospital, and their number is 508-862-5566. So those are two numbers that we're trying to advertise and get the word on.
And I think the other important thing that he talked about last night was around being a gatekeeper, and that anyone in the community can be a gatekeeper for youth and for others that are contemplating suicide, and that it doesn't have to be just the role of the providers. It can be, that as a community member we can all take a role, and we can have something to do, so that we don't feel so helpless when something like this occurs. She found
Welcome, Laura.
us.
So this is Laura.
Relax, Laura.
I'd like to introduce Maura Weir. She's the Youth Project, the Youth Suicide Prevention
How are
Project
you?
Coordinator.
You've been busy.
Yes,
You're out of breath, too.
Yes.
I am.
Is there anything we've been discussing? The situation of this wave of suicides we've experienced, and also the suicide prevention efforts in the week coming up.
That's what, if you
And
could
if
share
you want to
something.
share some of
Sure,
your...
great. I already handed this out.
Great, thanks.
Timing is impeccable.
Right.
Hand this
I'm
out.
sure Tim would agree with that. So next week is Suicide Prevention Week. It's on from the 6th to the 12th, and we've organized some activities in different areas around the Cape and Islands. The big events are on Thursday the 10th, which is World Suicide Prevention Day. So we're kind of in with international stuff, national stuff. That's really good. Did you talk about that already?
Oh,
Panel?
I didn't talk too much about the panel. No,
So on the panel we have two behavioral health specialists and one person that has attempted suicide and a survivor of suicide, a parent. So it's kind of mixed stuff. Peter Swenson from Nantucket is coming over to speak on the panel about his experience over there and how the community handled it, and maybe give us some ideas of what to do and what not to do. And also Nantucket is running their events on the Wednesday, and they have some post-traumatic stress management training for the high school. They have training with the guidance counselors, teachers, and the principals and superintendents of their school before that. And then they have their community event on in the evening, so everybody's welcome to go to that. And it's going to be kind of like a community forum type of thing where people can come and do questions and answers and just check in with where they're at, because they've kind of progressed along nicely. And then the rest of the week is kind of just me doing information sessions in different speaking groups and stuff like that. So I know on Tuesday I'm going to talk to the Community Health Center in Mashpee about it, and then there's some elder stuff going on as well through the Suicide Prevention Coalition with Paul Wild, and it's going to be a really exciting week, and I'm really excited about it, and hopefully I'll be live.
Paul Wild from Jordan Hospital.
Paul Wild, he works with the Elder Services, so he's been in contact with me to get some stuff done out where he is as well, and I think there's some other proclamations being read in other towns. Mashpee did theirs last night. Barnstable's doing theirs tomorrow. And we're well in with the American Association of Suicidology. They've provided us with all the leaflets, flyers, posters, pins, everything, and we're ready.
Is there any talk or focus on medications, actually pharmaceutical medications that are given to youth today? Medication is very easily and readily given to our youth for ADD and anxiety and depression. And some of these drugs, like Paxil and other drugs, actually have been, and even Elavil, will show that there are increased ideations, suicidal ideations that manifest themselves in young people who take them, especially young children. And I happen to had this experience in Maryland right before I left with a little brownie trooper I had, which was devastating. And I don't know if parents always. I know that I've always gone online if anything has ever been prescribed for my child or even any member of my family and myself. You want to start looking at the properties of these and the history and what's being said. And the doctor, I loved my pediatrician, but he sort of brushed it aside. Well, those are people that already have a predisposition. There's already mental issues, the mental health issues present. And they were. It's mostly in England.
These were given the medicine.
These were the London. This was the London studies. But as it turned out, no, these people really did not have predisposition or mental health conditions necessarily. And I know that there was hearings before Congress. Actually, the mother of this woman, this little child, was before Congress fighting this issue. And you dismiss because you're taking on pharmaceuticals, but. I think that there's also an education for parents to be aware that just because the doctor prescribed this doesn't mean that the responsibility that it's a good thing always, and that you have to question what the background of these drugs are, and if you choose to do this. I mean, there's other ways of dealing with your kids' anxiety, and it's a lot of work and a lot of time of your own. These are sort of like quick fixes.
Well, just a quick response as a clinician. Who works, I work with kids, a lot of people with depression, and I work closely with psychiatrists in primary care. I think it's really important to have an integrated approach when you're considering something like this. And you want to separate out, just because a kid is somewhat distracted or is sad in a day, doesn't mean they have ADHD, it doesn't mean that they're depressed. So you really, that's the first thing. And I think there is a tendency to just medicate somebody. But medication for me is about the symptoms, not about the roots. So it's almost like if you have an ulcer and you take a pain medication, well, you feel better, but you still have an ulcer and there's still danger. And the second thing I would say is it's really important, I think, to be a good consumer, read up on side effects, and work really closely, not just with an MD, but with a counselor and a psychiatrist.
Right, and to have constant communication with the kid.
The kid needs to be monitored.
Yeah, and the kid needs to be encouraged to say, I feel this way. Yep. I'm beginning to feel this way.
Yep.
Instead of just sort of reacting to that feeling, because I think, kids can kind of identify, especially smaller ones, like, I'm getting this feeling, and to really be encouraged to communicate in an unconditional way, as you were saying earlier. Yes.
I just wanted to comment on the fact that I think that this particular Suicide Prevention Week couldn't come at a better time,
Right.
as we have the debate in healthcare reform and about whether there should be death panels or how people maybe should not have insurance coverage in certain areas. That you're focusing on life, and not only life for young people, but life for elderly people. And that there is a way to live and deal with the so-called demons in your life too, and I think it's just really great.
This has come at this time because
We're focusing on the living and helping the people stay alive. So I think that's great, and I will be there, by the way.
Yes,
we
will be
That's
there.
great,
Excellent.
definitely.
I think that I just say the approach that we use is going to be very important, and I really stress that like a public health approach is really necessary because it's a community-wide problem, and we all have to kind of give our bit to it,
I wouldn't let this go without mentioning the importance of, as we go through this debate on healthcare, which is very important, at the session that I went to, that the Deputy Surgeon General was at, there was a National Association of County Officials, I brought up the point that mental illness, which is a significant piece of, that supports this kind of maladaptive behavior, is not recognized to the extent that it needs to be within the healthcare reform that we're going through. And I think that people need to hear that the healthcare issues are being based upon what you can physically see. Your arm is broken, you have a rash, you have something that you can go through some process and you can visibly see the significant change because you become well. But with mental illness, there's no sign that you have over there that that your brain is broken, and that and again, going back to what Dr. Macy said last night about the importance of looking at all of the elements of, let's say, of care, including the importance of a therapeutic liaison, which gets to the point of where are the resources to significantly report that. And I think people need to hear that as to how important it is that when we talk about the issue of healthcare reform, that this is a significant piece that is not given the attention that I think it needs to be given.
Okay, yeah, we need to move on.
Just really quickly, I just wanted to say,
Right, please.
one other member of our Suicide Prevention Coalition steering committee here, Kate McHugh, and
Hi, Kate.
also Ben, John, introduce
Yes.
Ben. I don't need to get
Caswell.
introductions.
Ben
Caswell is
thank
helping
you.
us.
I'm seeing that. What is
coalition
that?
with
Because I
our,
know we've met, Ben.
with our marketing and raising public awareness, so we're putting the resources and getting some good help.
Well, we really appreciate all your help on it.
Right.
Thank you so much.
Thank you.
All right, well, thank you, and good, all right. Very good to meet you. Yeah, we'll be there. That's no problem. Don't relax. Yeah, I'll be there as well. Yeah, well, I'm sure we'll all be there. Okay, we need to move into executive session. We have a few.
Why?
Thank you.
I move
There's a
I
couple
have
of personnel
issues,
issues.
family FMLA-related issues. I need some votes, and so they're executive
Okay.
I
session.
move that we go into executive session and not return to
For the
open
purpose
session
of-
for the purpose of dealing with personnel issues.
Medical-related
Votes
issues.
are
Aye, Lyons, aye.
very,
Thank
Take
you.
a